Can you run us through a typical day on hospital medicine?
Standard, as in most hospital settings. We get there around like 6 or so, get sign out from the night team and do our pre-rounding, and then starting at 8 we do didactics led by kind of a variety of people, either residents who have prepared a topic or one of our attendings, and then we also have like our cardiologist come specific days as well, and that goes for an hour, and then after that we meet up with our attendings so that we can do rounds. Oftentimes we'll do sort of just computer rounds, and then if we need to like see patients in person or do procedures, we'll do that afterward. And then the rest of the day is just doing admissions, following up on tasks, calling specialists, things like that. And it gives you a lot of autonomy during your day in order to be able to do procedures if needed, admissions, discharge planning, and things like that. I think one of the things that I've found particularly interesting about our program is kind of from day one, because you're working just one-on-one with an attending, you are in charge of all, like from admission to discharge of a patient, making sure that they are getting discharged in a safe place. If that's organizing home health services, working with our homeless outreach coordinators or social workers just to ensure a safe discharge. So I think that can be a lot to learn from day one, but also like nice to get it all 3 years. And then thinking about like opportunities for senioring, we still have that integrated into our program. On one of the services as a third year, you work with a first year from a different program, so that you still have that opportunity. And then there's still kind of like peer-to-peer working that you get, even if you're not working on the exact same team with the same patients, with the first and second years as well.
For me, on the surgical medicine rotation, at that point after rounds, I was able to have opportunities to go to the OR with patients. I was even able to go to a surgery where one of my patients that I'd been following for the past week was doing, so that was really cool. And after that, you have a lot of opportunity to reach out to your consults, to take in admits, to do discharges, and do a lot of the to-dos that you need to do, and then sign out to the night team at 5:30 or 6:30, depending on the day, and then usually finishing up a couple notes before we go home.